Hi there, my name is Dr. Hale Ching, and this study was performed with Professor Mark McAlinden and our colleagues here at Sheffield Teaching Hospitals in the United Kingdom. It is entitled Diagnostic Yield of Magnetic Assisted Capsule Endoscopy versus Gastroscopy in Recurrent and Refractory Iron Deficiency Anemia. The background to this is that in recurrent or refractory anemia, the guidelines suggest that we should consider repeating gastroscopy to ensure that lesions weren't missed during the first examination, and in addition, also to consider capsule endoscopy to image the small bowel. The Navi is a capsule that contains magnetic material and allows some degree of control of the capsule within the stomach using a handheld magnet moved over the abdomen, and we call this magnetically assisted capsule endoscopy, otherwise known as MACE, M-A-C-E. And following upper GI examination, the capsule is allowed to complete small bowel examination by passing via the action of peristalsis. So, we wondered if we could examine both the upper GI tract, that is the esophagus, stomach, and the duodenum, in addition to the rest of the small bowel using a single test with the Navi. And we conducted an observer-blinded study in which patients with recurrent or refractory anemia underwent both gastroscopy and MACE. And in order to ensure consistency in our reporting, all endoscopists who were involved in our study were asked to use terms from the same predefined diagnostic lists in their reports. And what we compared was the diagnostic yield as well as the patient tolerance of the two modalities. We showed that MACE identified twice the number of total pathology compared to gastroscopy. Of course, this included both upper GI as well as small bowel pathology. However, MACE still identified significantly more pathology than gastroscopy when comparing lesions only proximal to the second part of the duodenum, that is, the upper GI tract. Moreover, the comparison still favored MACE when comparing just lesions likely to be related to iron deficiency anemia. And finally, we found that MACE was much better tolerated than gastroscopy. Therefore, MACE seems to be a more sensitive diagnostic test for patients with recurrent or refractory anemia when compared to combined gastroscopy and small bowel capsule endoscopy. It is performed in a single visit, doesn't require sedation, and is preferred by patients. Further studies are required to compare MACE to gastroscopy for other indications such as dyspepsia, and this may help us determine whether it can become a non-invasive primary diagnostic tool in the upper GI tract. Thank you very much for listening, and I hope you find our article interesting.